Thank you so much for being with us this evening. I'm Katira Kapoor, and I have the privilege of being the Senior Director of Health Promotion, Wellness, and the Spark Your Health Talk series here at the 92nd Street Y. Spark Your Health is thrilled to be joined by board-certified neurologist Dr. Benjamin Kummer to discuss cutting-edge research and applications of AI and emerging technologies in our healthcare systems today. Our format this evening will be a moderated discussion followed by 15 minutes of Q&A, so please feel free to submit your questions throughout the duration of the program as we will be collecting them from the chat. We hope you will join us for upcoming Spark Your Health events, such as Lifespan Cardiovascular Health for Women with Dr. Leslie Shaw and Dr. Angela Bianco coming up on October 29th, among many others. I would also like to thank our Spark Your Health Talk series sponsor, Mount Sinai Health System, for their generous support. And now I'm going to go ahead and bring Dr. Kummer into the webinar. There we go. And don't worry, I still have a few things to say about you. So I'm now pleased to introduce our speaker this evening. Dr. Benjamin Kummer is a board-certified neurologist and clinical informaticist at Mount Sinai Health System and is triple board-certified in neurology, vascular neurology, and clinical informatics. He also teaches in both the inpatient stroke services and the vascular neurology clinic at the Mount Sinai Hospital. As a clinical informaticist, Dr. Kummer develops and implements information technology solutions to enhance care quality and efficiency, something we'll be talking a lot about tonight. Dr. Kummer has published work on the use of clinical informatics in neurology and teleneurology, as well as stroke systems of care. Thank you so much for being with us, Dr. Kummer. We look forward to learning much more about these exciting advancements and the use of AI in health settings with you tonight.
Thanks so much for inviting me. It's a pleasure to be here.
All right, so we are going to jump right in because there's a lot to talk about here. So let's start with talking about where we know artificial intelligence is already being utilized in medical settings and the pros and cons of this growing partnership with technology. So let's start with voice AI. Voice recognition software is starting to be utilized regularly when patients and physicians meet. This was actually new to me upon my research. So can you walk us through how this voice AI is creating more efficiencies for physicians? Are there any benefits to the patient?
Sure. So it's a good question, a very hot topic in AI these days, especially as it's applied to medical practice. I would say definitely one of the top AI use cases in healthcare today, I would say. So one major area is basically this AI system that sits in the background of the exam room, if you will, because you're asking about physicians and patients in their interactions. And we call that ambient AI. That's kind of the industry term. If you think about this conceptually, it's basically like like an Alexa kind of function, like a mic on the wall that basically records the physician's conversation with the patient, transcribes it, kind of like what happens when you use your smartphone for voice transcription, but basically for medical practice. And once that's transcribed into a digital format, the text from that conversation goes into your doctor's note through the electronic health record system, whatever they happen to be on. And if you've ever been to a doctor's office that has a scribe, like an actual person taking notes for the doctor or the provider, that's basically what this is. It's essentially an automated digital scribe that is a computer program instead of a human being. So, one of the major pain points for doctors in the office setting, and I have witnessed this and experienced this firsthand, is documentation. Particularly for folks who trained in an era where everything was handwritten and not computerized like it is now. I think there's some kind of a statistic out there that for every hour of patient interaction a doctor they spend about twice that in documentation, 1.5 to twice that, and which is just unbelievable, right? And the core of medical documentation, or your chart really, is notes that your doctor takes on you. And basically since the beginning of the 2000s, the government has mandated that everything be digital. So that's why everybody's digital now. It's actually kind of part of the law. And typically people will either document during the visit and sort of be distracted from dealing or talking to the patient or paying attention to them, really, because they're distracted on documenting and writing and typing. Um, or they'll do it afterwards, after hours, when they go home at night, after they eat dinner or whatever. And it takes a long time. And, the whole thing is kind of weird conceptually. You can imagine the absurdity of it as a physician. You have a conversation with the patient, and why do you have to like write it down all over again and like remember it? I mean, you're trained to do that, but shouldn't you just be able to have that conversation once and for all and just not have to remember it because you're not going to remember it perfectly. You can sometimes, but most of the time you're not. So this is really where this AI tool of ambient AI comes in. And it has a lot of efficiencies, I think, both for providers and patients, and they're kind of the same efficiencies. They're sort of the flip side of the same efficiency, really. Number one, you're cutting down on documentation time, which, as I mentioned, is a big pain for physicians. And the less time you actually spend documenting, if you're doing it in the visit, you actually have better throughput in your clinic. You're actually seeing patients probably faster, which translates to shorter wait times on the patient side. And then I think one of the most important things of all is really you're improving the ability of the clinician to focus on the patient and actually have like a conversation with them instead of furiously typing and documenting. You have an AI system in the background that's just listening. And then you also remember things that you might not have ordinarily remembered if you were just using your memory. And I said you remember things. You actually end up documenting things is what I meant. So the AI system will remember things that you talked about that you may not remember. And there are always these intricate details that patients wish they get into their documentation. And this is a way of getting those little tidbits that the doctor may forget when they're, doing things from memory. So there are definitely a lot of efficiencies for both providers, and physicians, and patients, I'm sorry.
Yeah, no, I love the effect that it seems to be having on allowing a physician to just be more present with their patient, which I think is probably really appreciated on both sides. I'm sure physicians don't really want to be furiously typing while they're trying to understand what their patients are going through. So
Yeah.
that's it seems like a huge benefit there. Okay, and then you mentioned the law. Is this something that you would foresee eventually sort of being mandated that everybody needs to have this in their practice and their hospital system?
That's a really good question. I don't know. That is anyone's guess right now. I'm not sure it will be mandated as law. I think, the topic of how medical records in this country became digitized is like the topic of an entire multi-hour long conversation. But I don't know. It's an interesting thought experiment that there would be some kind of regulation that would enable basically every healthcare provider in the country to use these systems, or maybe even have them, but not be forced to use them or kind of rely on them as a backup. I think that's an interesting possibility. I'm not sure it would ever become law, but if it gets to be good enough, it may be something that some health systems adopt locally, just kind of as institutional policy.
Yeah, I mean, I could certainly see physicians advocating to have that in their practice if it is creating those sort of efficiencies. So switching over to care manage a little bit, how are patients handling chronic disease management at home with the use of voice-enabled devices?
So, I consider voice-enabled devices to be a very wide spectrum of things, ranging from your smartphone and Siri, Google Assistant, whatever. I'm not promoting any of these vendors. They don't need any more money. But that's a kind of voice-enabled device. There's Alexa and Amazon and Google products that basically have now targeted the healthcare space. But basically, people use Siri and Google Assistant all the time to ask medical questions. This is something that people do, just like they're asking, like where can I find a bagel that doesn't charge me an arm or leg or something like that. Like it's the same kind of thing, and it's very hard to resist considering how easy it is to use Siri and Google Assistant and these other kinds of voice transcription technologies to not ask health related questions, kind of no matter where you are. The truth of the matter is, as well-run companies with a lot of smart people working for them. Amazon and Google have created products that have targeted the healthcare market. And Amazon specifically has come up with this thing called Amazon Alexa for healthcare. Um, and the Amazon Alexa for healthcare is basically like an ambient AI technology that is targeted towards more the hospital end of things for inpatients and inpatient and their families, really. Um, and in terms of diseases, there's been a fair amount of research that looks at the use of dedicated voice AI assistant, technologies in conditions like diabetes, hypertension, depression, chronic pain. A lot of them are still kind of stuck in the research phases, though, or proofs of concept. But in the commercial arena, you have players like Amazon and Google getting, you know, hip to this sort of music, if you will, and getting into the game.
Interesting. I wonder if they're leaning in for like physician input as they're developing these.
Yeah, they are actually. That's a really
Okay,
interesting
good.
point. Yeah, I mean, Google makes a product called Suki or something like that, or Siri. It has some cute name, but it's basically like Siri for physicians only. It's not really targeting patients. So there's a whole host of like sort of tell me this about medical condition Y or whatever, and doing it via voice transcription. Um, that's definitely happening.
Interesting. Okay, and last up for voice, are there any possible risks when it comes to utilizing voice recognition software or health virtual assistants? Is this, is the information being checked by the physicians to make sure that something, did the AI hear properly what actually happened in that conversation? Just curious if there's any risks that you're seeing.
Yeah, I mean, there definitely are risks. If you're using regular Siri or Google Assistant or, Samsung voice to text or whatever through speech to text, and you're basically using it as a search engine and stuff like that, you kind of have to think of it as like I'm using Safari or or Google. I'm basically asking Dr. Siri or Dr. Google for medical advice. And I like to tell this to patients that I see in the hospital or in the clinic where they see something on their MRI that they're not sure about, that's benign, that's like an incidental finding. But they look it up on Google and there's all this stuff that they read and I looked it up on Google and I tell them, Dr. Google did not go to medical school. So, and sometimes that elicits some laughs, sometimes it doesn't. But, you have to be cognizant that basically a search engine is a program that's trained to identify things that are sort of based on math and deterministic frequencies, like how commonly certain things come up in places on the internet. And it's not really as precise and as knowledgeable as a human being that has several years of medical training and experience, and you sort of run the risk of accessing information. I think the main downside is really accessing information that you don't necessarily understand or that sounds really terrible but doesn't really apply to you, or it sounds terrible and it's just not that bad. Like encountering white matter disease on your brain MRI, a little bit of white matter changes on your one sequence on your MRI is very, very commonly identified. It's not something that's cause for a gigantic amount of concern. It's definitely not an emergency. Um, and so you kind of run that risk when you go to these sources of information. You have to be cognizant of the limitations, and there's that kind of stuff is certainly not monitored by physicians.
Mhm.
We're not quite there yet, but eventually we'll probably get to the point where search technologies will have a tremendous amount of clinical input. And if you use things like Chat GPT, I mean, it's the same problem. They use, they're not really trained on medical data, even though they produce really flowery, beautiful output that's really nice to read and so well written. It's they don't really use medical terminology to train these models. And so when the model will come across a medical term that they really haven't seen as much as, something else or, the entirety of Wikipedia or whatever, it tends to not do so well with answering questions and being precise or actually staying on target. So you have to be very careful. And it can hallucinate a lot when it's actually presented with information that it hasn't seen very often. So just got to be careful with those things.
Yeah, I mean, and that's a great point. I feel like medical information is changing so constantly that, for the AI to keep up with it, it's like you said, it's probably going to sound a little bit worse when you do that search and probably still good to just go and get the real input from
Yeah,
the physician. Okay, so thank you for that. Let's move into detection, which I personally find really fascinating. I think we all understand that AI can be useful in supporting physicians in diagnosing disease. Curious to understand, where are we at with that process? Can we get more granular? Are there certain diseases that are being, that it's been more successful for diagnostics from AI? If you can just give us an overview of where we are.
sure. Um, a major area that has seen a lot of commercial success in AI is in the radiology space. And the truth of the matter, as everyone knows, not just in medicine, is that the human eye is not perfect. I mean, as humans, we're not perfect, but the human eye always misses things, and particularly subtle changes that don't have a lot of contrast. And one major area of AI applications is really identifying, making diagnosis from a medical image automatically before even the radiologist can even look at the image themselves. And that doesn't mean that the radiologist will not look at that image. It just means that the diagnosis was rendered very, very quickly without a human, waiting for the human being to actually read it. Some systems have developed the ability to actually order or reorder scans in a radiologist pile, for example, of scans that they have to get through, or their work list, as they call it. And based on the findings of the AI, to reorder the scans that have more emergent findings that are cause for concern to the top of the pile. So it's not just detecting, it's actually risk stratifying the individual studies so that they're interpreted more quickly. And so the patient could be helped faster. And at Mount Sinai, we actually innovated a system that does just that. This is already like 5 or 6 years ago. The Sinai Biodesign Lab here, with neurology and radiology and neurosurgery, basically built a pretty robust AI algorithm that did just that to detect brain bleeds on CAT scans of the head, and reordering the work list based on that. And that was published in a Nature journal, which made a big splash. It was very impressive, and that's already 5 or 6 years ago. So since then, AI and imaging has become very, very commonplace. As a neurologist, I look at neuro images very commonly, brain MRIs, neck MRIs, things like that. But in not just in the brain and the spinal cord, you know, we're definitely seeing a lot of advances in AI in those areas. Um, and we use a lot of newer AI products that basically can I do tons of different kinds of identification tasks. Um, we have an AI algorithm that is able to identify blocked arteries in the brain when somebody presents with a stroke. Um, that same company makes another algorithm that can detect a brain bleed similar to the model that we trained. It can also calculate the size of an aneurysm, detect that an aneurysm is actually there. Some aneurysms are very hard to see, where they're very sort of flat and like blister shaped, as opposed to sort of looking like a bubble, which is typically what they look like. Um, and not only do the models actually detect those things, but they also, you know, create a really annoying alarm that wakes you up in the middle of the night and tells you that you have to deal with the scan because there's this very concerning finding. So, and then on that, after that, there's a whole platform that you can use to chat with the other doctors on your team and figure out what you want to do with the patient. And, in real world studies, these platforms have been shown, particularly the ones that detect the blockages, um, because those are very, very amenable to treatment, to help stroke patients get care a lot faster than without those platforms. Although this is still very, it's not purely randomized, very, very high quality data. It's relatively new, but there's definitely some signal that this helps accelerate things because it gets people in front of the scan and it gets them talking about what they want to do with the patient. And the fact of the matter is basically, humanity's demand for medical services is basically infinite. So we're always basically playing catch up with demand, no matter how we slice it and how much we expand our capacity for healthcare services. Um, we can build 5 more hospitals and, they'll all be full. Like the capacity is just, no matter how much capacity you create, there's always going to be demand. It's never going to go away. Everybody always needs medical services. And paradoxically, sometimes the more you create capacity, the more it tends to fill up. It has that kind of effect.
Yeah.
Um, and, a hopeful stab at addressing some of that demand is, using some of these programs, or at least to triage things. And, we can't make more radiologists. They take, 11 years to train, but we can build computer programs that probably take a less amount of time. And, your average radiologist will have to get through a lot of normal scans that kind of is tantamount to drudgery after a while, just like normal X-ray, normal X-ray, normal X-ray, normal CAT scan, normal CAT scan. There's a lot of things that are abnormal, but the majority of these reads are usually normal. And same thing with MRIs. It doesn't really matter what modality you're using. And one of the major value adds of AI in the diagnostic imaging space is that it kind of automates this rote stuff that's so easily ingrained in the radiologist's mind that it really frees up that mental capacity for the radiologist to identify something that's abnormal and really home in on what that could be. And we call it practicing at the top of the license. That's what I like to call it. And kind of automating the stuff that's a little bit more straightforward, that you don't really need a huge amount of expertise to really delve into, but really laser focus on things that are unusual. And something that's really, really interesting in imaging AI that's become very popular over the last couple of years is this thing called generative AI, which
Mm.
some folks have probably heard of. Um, ChatGPT is an example of generative AI, but it's using text. But there's the analogous type of model for imaging. So you can basically create scans from scratch, like literally from a few ground truth examples. You can have a machine learning model basically reconstruct exemplars of this same type of disease that you have on an image with just using a few examples. And we're actually working on something like this in my lab at Mount Sinai to basically generate a special kind of CAT scan that you can only really get with much ado, and it's very complicated to get it for most stroke patients. At our institution, because we're a large academic medical center, it's relatively easy, but across the country, it's really not that easy because it requires special technologists and a special type of perfusion injector and things like that. But so we're using generative AI to basically develop this special CAT scan, basically recreate that image at the time the patient rolls in the door when they just get their very, very first CAT scan. So cutting out all that time until that really advanced study has to be obtained. And that reduces the time to treatment because that special advanced scan can really impact your treatment decisions. So that can really accelerate how quickly you can get stroke treatment and how well you do post-stroke.
Sure. Wow. Thank you. There's so much there. It's fascinating. I'm feeling like we have a part two coming up. There's just so much to dig into. But two quick offshoot questions from everything you just said. So I just want to clarify when you mentioned the detecting a brain bleed in a patient, was that patient scenario in the hospital already being monitored, or were they, because I know there's also wearables now where a patient could possibly be in their own home and a physician is detecting something, from their own home. So just wondering if you could clarify where we're at with that technology.
Yeah, I'm sure. So that study specifically was in hospitalized patients, but the model can be extended to the outpatient setting also because it basically just takes the images from the scanners and then processes them. So the outpatient scanners store their information in the same places as the inpatient scanners in the hospital system typically. So you could ostensibly recreate an architecture of that model that just looks at outpatient studies. And so while we did the research in the inpatient setting, it can definitely be applied to outpatients.
Okay. Thank you. And then my other question is just assuming that not every hospital system and practice has these technologies yet. So my question is, are you seeing any movement towards referrals if, for instance, a patient goes to a particular, a quick outpatient clinic and then they say, you know what, we're not exactly sure what's going on here, but we don't necessarily want to send you home. We're going to refer you over to, say, Mount Sinai, for example, where we know that they have this technology. Are you seeing any of that gravitation?
We definitely see that all the time. I mean, I can't even count I can't even tell you how many times I get phone calls from other hospitals that want to transfer patients for stroke because they don't have the facilities or the expertise that they have that we have here for treating stroke, for example. So that was happening irrespective of AI. I think as AI has become more and more prominent, it's actually popping up in some of the smaller hospital systems. And it's actually generating a lot of referrals, definitely.
Okay, interesting. So, and then I just want to spend a little bit of time with prevention. So if you can just fill us in on where are we at with AI in the prevention of disease. I've, read a little bit about possibly detecting cancerous cells a little bit sooner. I'm sure that people are curious, what kind of tests, what kind of AI support can they get in being ahead of the game with their health?
Yeah, sure. That's a great question. I mean, it's also like a 2 hour long conversation, but there really are a lot of applications for prevention, and it's prevention and diagnosis kind of overlap conceptually because you know prevention really relies on making a diagnosis, if you will. So you have to recognize that something's there to prevent a future state. That's usually the calculus and the way that these things are structured. But the distinctions, like at least philosophically, can be a little fuzzy. But one really good example that's not super complicated um, and fairly well understood is just heart monitoring for atrial fibrillation, which is a major risk factor for stroke. I'm obviously biased because I'm a stroke neurologist, but you know, smartwatches like the Apple Watch, for example, put a lot of R&D effort into developing an algorithm that can actually detect atrial fibrillation, which is this abnormal um, contraction of the heart that tends to form blood clots that then can go into the brain. They really spent a lot of time trying to develop an algorithm that just sits on your watch and can monitor your heart rate and it can detect things. And it can detect a fib. And so if you recognize a fib, and you're just going about your everyday life, you may not notice it if you're not wearing a smartwatch. Some people will be in a fib for 10 minutes and they'll go back to normal and they don't even know that they had it. But if you have this detection mechanism and you're just going about your daily life, you can go to your doctor and say, hey, I had this period of AFib detected on my watch. What should I do about it? And if it really is AFib, which it usually is because Apple, made a significant investment in how good this works. You can potentially be put on a blood thinner and significantly reduce your future risk of stroke. And that can really change your life. You might not even, you might not know it by not wearing a smartwatch. It's not saying smartwatch is a panacea. You should always have a smartwatch. It's just that's a very simple example of where AI is, active in prevention. And there's stuff in dermatology also that can distinguish melanoma from ordinary moles. In colon cancer, for example, there's in GI and in colonoscopy software that actually captures the images and does all of the data transfer for colonoscopies. There is an AI software that company makes that can actually analyze the polyps that are seen in the colon and can distinguish which ones are more malignant appearing or more high risk appearing and which ones look more benign. And that's definitely been around for a little while.
That's fascinating. I mean, I just love it because this is what we do in Spark Your Health is health promotion, getting people to, understand before the problem occurs. And it sounds like that's exactly what AI is helping to do. You're making a great case for the use of AI in a medical setting, I have to say. Okay, so let's get into biomarkers a little bit. Can you give us some of the latest developments in remote patient monitoring and how this is helping both patients and their physicians with improved outcomes or oversight? So we touched upon that a little bit.
Sure. Yeah. No, remote patient monitoring is something that's really fascinating to me. I think it's just like such a cool area. And the truth of the matter is, I'm going to just say RPM for short because it's kind of a mouthful. Um, it's been around for a while. I think the first billable RPM code that the Centers for Medicaid and Medicare actually came out with was in the early 2000s. So the most basic RPM code that physicians have been billing for has been around for almost 20 years. But I think over the last 15 years, RPM has become more and more important, and really became an above the radar technology that a lot of people talked about during COVID, obviously, along with video telehealth and, phone calls and all the things that happened during COVID that forced us to be, primarily virtual. Um, and some of the payment rules changed in 2019. CMS came out with some new codes for doctors to encourage them to start investing a little bit more carefully or heavily rather in RPM, because some of these codes actually allowed the practices to be reimbursed for the amount of money that they spent on the devices themselves, whereas the older codes didn't. Um, and with the advent of just faster, more powerful, cheaper computing and smaller microprocessors, RPM is definitely becoming more and more widespread. And the promise of RPM is really that it kind of gets to the issue of, one-time visits are often inaccurate snapshots of what's really going on with the patient. And, a more accurate picture often comes from monitoring a patient over a long period of time, in not necessarily a continuous way, but a quasi-continuous way. Instead of it being once every 6 months, it's, once every day or twice every day. And for example, your blood pressure may be much lower or higher when you're at home doing your usual activities, but your medications get adjusted based on one in-office measurement, which doesn't necessarily extrapolate to the rest of your life, right? And things are often different in between visits. And it's not that people are, lying or withholding information. They're not necessarily aware of what's going on. And blood pressure is just one really simple example. And it also happens to be where RPM is used very, very widely.
Mhm. Great, thank you. And are you seeing certain populations using RPM more than others? Is it more helpful with certain diseases or proactive? And
Yeah, I think that's a great question. I think, so, typically the disease states that you see represented in RPM tend to have some kind of physiologic signal that's monitorable or of some kind of a vital sign. So for hypertension, high blood pressure, for example, there's blood pressure monitoring. For diabetes, there is continuous glucose monitoring that look like little stickers that basically sample the capillary glucose right at the edge of your skin with a tiny little needle or sensor. Um, for COPD, there's, oxygen saturation or that SpO2 percentage number that you might see on, when you go to the doctors and they measure your vital signs when you're waiting for them. For heart failure, there's weight tracking, because when people have really bad heart failure, they tend to accumulate fluid and then they become heavier. Um, and for instance, at Mount Sinai, in terms of RPM, we have a very large blood pressure monitoring program that uses RPM. We have about 2,400 patients, very, very diverse group of patients from, different backgrounds. And we've actually been able to achieve a fair amount of blood pressure reduction and control through this program. And basically, we have pharmacists monitoring the blood pressure variations on a daily or twice or every 2 day basis, and they can actually adjust the medications under the supervision of a physician. So the physician doesn't actually have to look at the blood pressure themselves. And so it just means that the monitoring is much more frequent and the changes in the medication are much more tailored. So that's one area. But there are other areas in disorders that are not as easily quantifiable, because like everybody agrees that blood pressure numbers are what they are, and that's just kind of understood to mean a certain thing. But in diseases like a lot of neurological conditions, things haven't really been quantified as much, except for a few diseases like Parkinson disease. And Parkinson disease RPM tools specifically have been in the news lately because I think there was recently an app that obtained FDA approval to monitor certain Parkinson symptoms, like the shaking that they get, which we call tremors, and abnormal, sort of uncontrollable movements that we call dyskinesias. So the patient's smartwatch or smartphone can actually work with this app and use the sensors in both of those devices to actually detect those things. So the FDA basically approved an algorithm and a platform to detect those things using AI. And then that gets sent to the neurologist that basically has a graph of, okay, you had a tremor at this part of the day. Your tremor was a little bit worse when you did this over the course of, time. And, they can adjust medications based on that. So that's really, really cool. And that device can also channel in electrical settings for implanted deep brain stimulators that some Parkinson disease patients actually have implanted into their brains to control their dyskinesias, which is a more, it's just been around for a little while now as a technology that, the DBS technology, but it actually can extract the readings and the settings from those devices, and those things can then be changed remotely after looking at the data from this app. So it's pretty cool.
It's
Um,
incredible.
yeah,
We just actually did a symposium on deep brain stimulation, and it was incredible to see the benefit that it had to the patient, and
it's amazing.
that it could be changed remotely and be tracked, and yeah, it's incredible. Thank you for that. So I want to shift. I'm going to keep us moving along because there's just so much to get to, and I just want to remind the audience to go ahead and submit questions because we will shift over to your questions very shortly. So let's shift into pose tracking. This is a little bit more up my alley with exercise physiology, but talking about movement patterns in the musculoskeletal system. Can you tell our audience members who are maybe not as familiar with pose tracking, what is it? What is it all about? And I'd like to know how it's being utilized, how it's benefiting patients.
Sure. Um, Post tracking is basically a general term for AI technology that can detect uh, the position of a body. In other words, basically identify body parts over time, but using video. So this technology basically recognizes where the body is in space and time, and then kind of draws a stick figure over the body. And I say body because it's not always human beings. It can be used in animals for different experiments, for example, in lab mice or lab rats when they're doing behavioral tests. Basically, you're just using a video to determine where the body is in space and time. And that stick figure position, the change of the position is basically turned into numbers, and then a computer can interpret that. So it's basically turning something that's ordinarily, qualitative that you might have to just observe and take notes on or describe into numbers. So it's very, very powerful. And you can imagine that, with the videos circulating everywhere and everything's a video now, people learn through videos on YouTube, it's very, very, very powerful. And it's been widely used in other industries other than healthcare for a long time, like security, in professional athletics, sports gambling, things that have to do with quantifying motion very, very, very specifically, very, very, very carefully. It's also been used, as I was saying before, to quantify the movements of lab animals, so it doesn't have to be just human beings. But basically, what we're starting to see post-tracking in healthcare is in diseases where body motion is particularly important to monitor. And that is becoming a very, very exciting cutting edge area of research in my field, which is neurology.
Yeah, no, absolutely. So my understanding is that a pose tracking system can match a movement style to a specific type of therapy. So is this ultimately supporting more individualized care?
Yeah, definitely. I think I would say that post-tracking systems are basically really good examples of high personalization technologies. Because if you think about it, the way a body moves, like somebody's gait, for example, is very unique, right? You can tell that somebody's walking a certain way. It's like their walk. It's like a thumbprint, if you will, right? Um, and because they track that unique movement, these technologies are really relevant in mobility disorders like neurological conditions, stroke, Parkinson's disease, neuropathy. They usually manifest with some kind of motor impairment. But you can definitely be very, very precise about how those movements are detected and quantified. And then another area that's not so much a disease, but more like a specialty or a type of treatment is PT and OT. So you
Ask
can
about that.
yeah, you can provide very precise analyses of body movement in response to a particular exercise, for example. And then, a PT that looks at your video and the analysis of the video can basically say, oh, well, your muscle balance is a little bit off. You should do these exercises to strengthen that, and you should do things a little bit differently or try these exercises because things are they're looked at so carefully and quantified so carefully. Numbers speak to people differently than the way images do, even though images are very powerful also. So it can have a profound effect on treatment, particularly in the area of like PT and OT. Um, and
Absolutely.
we're definitely doing a lot of that in post-stroke monitoring. We're doing this in hospitalized stroke patients and stuff like that.
Yeah, I was going to say, I'd imagine that it really helps in the tracking of progress. And almost like what we started talking about at the beginning of this, the automation of these notes, it's kind of compiling all of the details and hopefully helpful to, especially I would imagine PTs and OTs and compiling all of that data and going back to you as the neurologist and saying, here's how the work that we're doing is paying off and improving this individual's quality of life. That's great. Okay, so we're going to shift into how AI is impacting the healthcare industry as a whole. Before we go there, I did forget to ask one thing about the wearables, which is I'm curious for your thoughts on how the wearables tracking devices, how this impacts the maybe mental health of a patient. I think it can be really probably a positive tool to see progress, but it also might be a little bit deflating if you're not seeing that progress, or if you're seeing, like you were talking about dyskinesia, maybe they're having more dyskinesia. So just curious if you have any insights on, and if there's been any research done on the maybe pros and cons of the wearables and maybe having too much information.
Yeah, I think too much information can be a bad thing, that's for sure. So I think, you know, it can be a little discouraging to be presented with so much information that may not really be to your liking or may not really be what your target is. And I think it also creates a pressure to, charge your device, focus on your device, make sure it's on properly, make sure it's collecting, looking at it constantly, and it just kind of may distract you from your overall life. I don't actually know of any research that looks at the mental health effects. I think it's a really interesting area. Um, but, I think things are becoming more and more sophisticated. So like, if you think about how many people own smartphones in this country, I think it's like 80% or something. 80% of people in the US, which is a lot of people, own a smartphone. And those smartphones all have wearable sensors. They have an accelerometry, they have angular accelerometry, not just linear. They have, a temperature sensor. Some of them have barometers. They're very sophisticated devices. And those are only getting more and more sophisticated and precise. And I think eventually people are not even going to think about the sensors that they're wearing because they're not even wearing them. They're just on their phones and they're just in their pockets and they're not doing anything to explicitly to like activate them. And so I think a lot of that pressure will probably go away as things become more and more constitutive and just deployed in smartphones in general.
Yeah. Very interesting. So I think we can't talk about AI in healthcare without bringing up privacy. So of course, we know all of the benefits. You've spoken to a lot of them this evening, but there may also be some concerns out there about staying vigilant about one's privacy, especially with digitizing all of this information. So can you speak to again, any updates you've seen in the world of upholding privacy for patients? What kind of tactics are being deployed to make sure that we're being HIPAA compliant?
Yeah, that's a very important question. And a very big problem actually, because for privacy, I would say the issues are not so specific to AI as much as they are related to digital health and, mobile apps and things like that, and technology and healthcare, widely speaking. Many commercial apps and healthcare software and technologies, some that use AI, some that don't, are really not, they're not considered to be entities that are covered, so to speak, covered entities under HIPAA. And so therefore, they're actually not required to abide by HIPAA, which a lot of people don't realize. But HIPAA really applies to doctors' offices, healthcare institutions, hospitals, care networks, things like that. And what they call business associates, which are basically companies that are involved with providing healthcare in some sort of third-party capacity. But these companies don't really fall under that purview. And so they're not beholden to a lot of the HIPAA rules, right? And so some of them will actually use your data. Some of them will be honest about it, and some of them won't. Some of them will be seemingly honest about it and actually tell you that they're doing something with your data that they're not. Like I think there was a study that came out 3 or 4 years ago in JAMA Neurology that looked at neurological care applications, mobile apps for neurological conditions. And a significant proportion of those apps had statements embedded in their software that actually told patients and users that they weren't going to share their data. But then in an analysis, they actually found that a significant proportion of those software platforms actually did share data because they don't have the legal repercussions of HIPAA compliance due to what I just mentioned. There are some companies that are really better about privacy than others. I mean, if you look at a company like Apple, Apple is not really a software company as much as it is a hardware company. At least that's the way that they've positioned themselves in the tech marketplace. They make cool phones, VR headsets, iPads, things like that. They're not in the business of like owning people's data and selling it and doing stuff with it. They've really taken the exit off the highway, so to speak, with respect to that. And they're very conscientious about how they ask your permission to use your data. But once you say yes, you know, if you want to use an app that uses that, oftentimes you may change your mind, but you may forget how to do it, or you may not really understand what extent the permissions are, set to. And user licensing agreements are not always clear to people. Actually, I think the vast majority of people don't really read end user licensing agreements, and a lot of stuff is buried in the fine print. I'm not saying, every software that you download and every app that you put on your phone, read the EULA, but like you have to realize that a lot of these apps, they can do this stuff, and so you have to be very careful.
Hmm. So it sounds like it's still in progress. But I think that's a great point, just to be conscious of where you're putting your own information.
Yeah,
Yeah.
definitely.
All right, so we're going to shift over. We have some excellent audience questions. We're going to shift over to those now. So someone is asking, are most New York City hospitals sharing information for patients who have doctors at different institutions? So I think part of the question is also there's all of this ease of maybe information flow with AI. So are you seeing more information crossing from physician to physician?
I would say yes, but it's probably not because of AI. I think, the federal government has actually mandated a certain degree of interoperability between healthcare systems. And there's actually a core set of data elements that the US federal government has basically promulgated has to be the core set of information that's exchanged. But I really like this question because it's actually something that I teach my residents when they're presenting on rounds. They'll say, well, they went to some outside hospital, last year and had a stroke, and we don't have the details. But the details are actually just buried in a certain part of the EHR because of this interoperability rule. So I always tell my patient and my residents and my fellows, every patient has data. It's just a question of how hard it is to find it.
Mhm.
Because the fact of the matter is, to your question, hospitals have increased their sharing of information because of the efforts of the government and the informatics community over the last 10, 15 years. Epic is one company that makes probably the most common EHR system in academic medical centers. They were actually one of the first companies to really build out a very robust interoperability system that talked to other institutions that also have Epic. So you can see through the system called Care Everywhere, you can actually see the patient's records from other institutions as long as they have Epic. So that has been around for a while, actually. That was extremely innovative. People don't talk about it enough, but it was really powerful. But in the last, 10 years, you can see data from other systems that are not Epic systems because they're in this interoperable format.
Mhm.
Um, so there's different kinds, there's CDA and CCDA and things like that, but you can basically find a medical history, you can find documentation. I don't know if the increase in shared data is really a product of AI taking off. I think it's just more of a product of the interoperability trend that we're seeing. There's still systems that don't talk to each other, unfortunately. So, but to answer your question, yeah, we are seeing more and more of that as systems become more and more interoperable.
Got it. Thank you. I feel like this is a great question for you. So, Dr. Kummer, please comment on the difference between AI and large programs analyzing large data sets. For example, programs that analyze health data that might indicate dementia risk decreases if one eats blueberries. The large data analysis program versus AI would do different things with this data.
Yeah, I think that's an almost rhetorical philosophical question. And it really comes down to how the system is deriving conclusions from the information. The difference between I'd say ordinary, but they can be very complicated statistical models, like regression and different kinds of tools that have been around for a long time, and machine learning and artificial intelligence, is that generally machine learning and artificial intelligence models tend to be a little bit less explainable than things like regression or Poisson distribution or Cox regression, those kinds of tools that have been around for a very long time to estimate risk and are fairly explainable via mathematics. You can express these things in mathematical terms. And so I think it's really a question of where how the model basically comes up with its conclusion. So if you're analyzing a very large data set that predicts, the risk of dementia based on dietary factors, I guess, yeah, factors, you can basically, if you're constructing some kind of a logistic regression model or something that uses a fairly well explained and understandable statistical model, it may not be considered, complex artificial intelligence, but it could be argued to be a very simple form of machine learning, if you will.
Got it. Thank you. All right, we're going to start winding down here, but we have time for a few more. So I understand we have to speak about this generally, but are there certain scenarios that you would tell our audience and for them to tell their family members that, hey, if you're in this sort of situation, you really should be advocating to maybe go somewhere that has this AI technology? I mean, I'm going back to thinking about the headache that's maybe not diagnosed and maybe there's a brain bleed happening, or are there certain situations that you can leave our audience with, this is really a scenario where you might want to advocate to have further technology support your diagnosis or what you're going through?
Yeah, I think
I
it's an
understand it's a hard one to answer.
yeah, it's definitely a difficult question to answer because there's a significant amount of downside, by saying no. That said, I think the majority of the healthcare AI tools that are out there now are not what I would call autonomous. Like they don't replace doctors. They don't just independently generate conclusions and then do things without human beings being in the loop. I think basically every healthcare AI application that I can think of has a human in the loop. So it will come up with some kind of a conclusion, and then a human being will have to check it. So it's not overriding or, just doing things like Terminator 2 dystopian future kind of fashion. That said, so because AI systems are not really replacing physicians, I would say there's not a really, pressing obvious reason to say you have to go to a hospital that has artificial intelligence. But on the flip side, I do think that hospitals that have artificial intelligence systems, at least from the perspective of, neuroradiology and stroke, they do tend to detect things in populations where, you know, in low volume centers, for example, that are not used to seeing stroke or not used to seeing specific types of things on radiology images.
Mhm.
But it's not like, I'm not sure it's a slam dunk reason, go to this hospital because they have AI. A lot of hospital systems already have AI into their budgets. Like it's so rampant right now that, it's probably happening behind the scenes and you may not even be aware of it. As a patient, but as a physician, I can tell you that, this is very, very, very much part of hospital systems roadmaps for the most part. Everybody's trying to use AI, and everybody's trying to use the technology in the most cutting edge way as possible to help their patients.
I mean, that's really good to hear. So, we'll wind down with one more question from the audience, which is you had mentioned at the beginning of the talk radiology as really benefiting from the use of AI more than most areas, but they're asking what are other areas of medicine that you think will benefit from the use of AI, or maybe some other areas that we didn't get to talk about this evening?
Sure. I mean, I think AI is also very, very useful. We didn't have a huge amount of time to talk about some of the other use cases, but um, their AI is very, very powerful in just cramming together lots and lots and lots of information with very subtle changes that may be hard for human beings to distinguish. And so, there are a lot of AI models that are deployed by Epic, for example, that predict whether you're going to be readmitted or not, using data that's just in your EHR, your labs, the reason why you were admitted or your prior hospitalizations. Or whether you're going to actually decompensate, while you're on the floor. And hopefully that doesn't happen to anybody in the audience, obviously, but, um, you know, risk predictions using electronic health record data. That's definitely something that Epic has been in the business of doing for a long time now. It's not new. It's been around for like maybe 5 or 6 years, but it was under the radar and not really released to the general public, or general, hospital public, if you will, until like mid-COVID. They were developing it for a long time, and there are lots and lots and lots of other platforms that do very similar things. They kind of sit in the EHR layer and they take the data from that EHR and then they'll spit out some kind of a predictive output, that then gets fed to the clinician and tells them, hey, your patient has, triggered this model prediction. What do you want to do about it? I'm not interested in doing anything about it. Again, human in the loop, right? I'm not interested in doing anything about it, or I'm going to take this action. I'm going to order this medication. I'm going to intervene in some way. So that's one area that definitely has been used. And then, artificial intelligence is really, really great at, quantifying or extracting information from raw data, like waveforms, for example, like, the recordings that you get on your smartwatch, or EKGs, or brainwave tests, things that are very, very hard to really quantify very, very easily with the human eye, um, and can be costly to review, on a person basis, is one of the areas that, those are some other areas where AI is very, very useful.
Got it. Well, I think as we wrap up, we got really granular and really detailed in this talk, and I appreciate it. And maybe we'll just take a step back as we end. And on a global view, where do you see us as a country being with AI in our healthcare systems? Do you feel like, are we kind of at the forefront? Are there other, countries and places where they're doing even more advanced things that you think, oh, we're working to get to that point?
That's a good question. I don't know if we're necessarily further behind in terms of the innovation. I've read a lot of research in AI and information systems in healthcare. Um, I don't know if the US is necessarily behind. I think where we are lacking is in the interoperability dimension, in having systems that talk to each other. A lot of countries are much smaller than ours. They have national health systems. I'm not advocating for a single payer system. That's not my soapbox right now. But what I'm trying to say is, you know, they have they have a much smaller population, and they usually have one medical record system, which just shares the data, and that makes implementation of AI models way easier, because the way things are expressed and recorded in one system may not be the same as another system in the US, for example, or in non-interoperable systems. So that really hampers the adoption of AI. It's not so much in the innovation R&D funding spaces that I think we're behind. I think it's really in the actual healthcare information infrastructure.
Hmm.
And we really need to improve our rural internet access and digital and bridge the digital divide with people who don't have access to digital resources or are not internet facile and don't have those kinds of resources. In rural America, it's very hard to get online. Even though here in New York, everybody takes it for granted. And that's really hard to, do telehealth and do AI when you don't have those resources. So we really have to do that on a national level.
Absolutely. Still a lot of work to be done. But Dr. Kummer, we really appreciate your time. This was absolutely fascinating. I know that our audience really enjoyed it. I feel like we already had some requests that I think this needs to be a yearly discussion, which in prep for this talk, we actually said this really should be a yearly discussion because the advancements are just happening so quickly. So again, we thank you for your time. To our audience, thank you for being with us. We will send a post-event communication with more details, and we hope that you'll join us for an upcoming Spark Your Health talk. We have a lot of good stuff on the horizon. And with that, have a good night and stay well, everyone.